Hi, my name is Richard Ortiz, MD, and I've been asked to talk to you about weight management. So, in the subject of weight management, there's a lot of areas to look at. And the first thing I want to point out is the disease associated with being overweight, which you're usually already aware of: diabetes, heart disease, hypertension, also obstructive sleep apnea, and arthritis or degenerative joint disease. Now, there are some things you may not be aware of. There are diseases that are also associated with being underweight. So you might think about bulimia and anorexia nervosa and sometimes the vitamin deficiencies, and that would also include mineral deficiencies and even possibly anemia. So how do we determine where someone is in their weight stature? Well, there's a common phrase called the body mass index, or BMI as people call it. And it's based on the height and weight. And I have an example of the chart that we use. Now, our computers here actually will calculate it, so we don't have to worry about going through the steps, but there is a formula to calculate it. The only thing I have to say about this is it's a tool. It'll help you look at where you're at and where you'd like to be. However, the concern I have about it is that it's one scale based on male, female, height and weight for male, female, bone structure, muscle structure. So you have to take that into consideration when you're looking at goals for people. The other thing to look at is someone's BMR, which is their basal metabolic rate. Now, the basal metabolic rate is going to be based also kind of on height and weight, so there are some areas of which you may estimate incorrectly on. If you're muscular, you may not be giving the person enough calories, and if they're overweight, then you may be calculating more calories for them. In the basal metabolic rate, we have to consider that there's also different type of body types, and so people will burn calories at a different rate. So when it comes to foods, we're all not created equal. Okay, there are your ectomorphs that are your cross-country runners, the ones that can eat a lot of calories and still stay thin. You have your endomorphs that may limit their calories and still have difficulty losing weight, and those are usually your people who are overweight, markedly overweight. And then you have the mesomorphs, which I believe are the lucky ones, because they're the ones, whatever they eat, they just turn into muscle.